The royal family want minimum disruption to the nation as the public mourns. That's according to palace sources. The decision to close or remain open is up to individual organisations to decide. Although you have to ask yourself, is it? Because even if you stay open and, for example, your childcare provider closes, you can't go to work. Let's talk to dentist Dr. Nilesh Palmer, owner of Palmer Dental Group. Hello.
Good evening.
It's a difficult decision, isn't it? What have you decided to do on Monday?
It's very difficult, Claire. Dentists, we were shut for 3 months during lockdown, and I'm now booking 4 to 6 months in advance. So if we have an unscheduled closure of the clinics, it's very difficult to find space to see these patients. We've basically spoken to the patients, the ones where we would struggle not to see them for another 2, 3, 4 weeks. We've given them the opportunity to come in if they need to. We'll have a skeleton staff available if we need to see patients. But surprisingly, all of my patients have said they would rather reschedule.
Well, that's good, isn't it? But what about somebody who might need to see a dentist in an emergency? What happens then?
Yeah, it's very difficult. Normally with planned bank holidays, we have out of hours organised by the local primary care trust. They should be doing the same thing for Monday, but we don't know as it currently stands. I think we will plan to be available if there are any pressing emergencies. But again, with unscheduled closures like this, it's very difficult for us to logistically plan in advance. Like you mentioned, my receptionists, my nurses, my other dentists, they all have childcare issues as well on the Monday. So it is a bit of a juggling act for us.
And did they want to come to work? I mean, what was the split then? Were people saying, well, look, we are an essential service, I'm happy to come in, or what were they saying?
Yeah, unfortunately, my team are very accommodating, and I wouldn't expect to run a full clinic, but we do have enough staff who are willing to come in to see emergencies if we need to. But again, it is going to be tricky for a lot of dentists to have that facility to see patients, especially in emergency. And the one thing as dentists we don't want is patients who've got dental problems start to clog up A&E, because A&E is going to be busy anyway. So we'd like to see them in the dental clinics if we can, whenever we have capacity to do so.
I mean, I've been interviewing people. That we had a gentleman on yesterday who, it's not necessarily an emergency operation because he would have already had it, but he'd been on the list to have a stent removed from a gallbladder, and he's living in extreme discomfort. Now, that has been deemed a non-essential or non-urgent, a routine operation. So it's now been postponed. Do you think more thought needed to go into this?
I mean, personally, I thought they would have the funeral on a Sunday, which would give us much less disruption to businesses, to healthcare, to everything else. But it has been sprung on us very, very quickly. And I understand the need for people to mourn and the people to celebrate the Queen's life. But again, it is very tricky, especially for healthcare, which is running at capacity on a good day. Where do we put these extra appointments? It is very, very challenging.
And made even more so because we know that we still have a huge backlog from the pandemic to make our way through when it comes to health appointments. Yeah,
the backlog is incredible. The NHS as a whole, not just dental, but speaking to my medical colleagues, we are pretty much at capacity all of the time. And anything like this or any sort of blockade in the actual normal workings of a dental practice or hospital clinic or GP clinic is very, very difficult. As a side note, I got a text message from my GP clinic telling me that they'll be closed on Monday as well. So it seems as if healthcare will come to a slight standstill on Monday.
Good to talk to you. Thank you so much. So the good news seems to be if you do need to see a dentist because it's an emergency, those services will still be available. Thanks for joining us. Dr. Nilesh Palmer, owner of the Palmer Dental Group.
Thank you, Claire. It is